Hi, this is Brian Wormers, and I'm going to present an overview of the case study poster presentation for NUR431 Nursing Capstone. So the goal for this is completion of the nursing program is to have excellence in practice. This poster is going to focus it on that excellence in practice and give you a chance to integrate culture, nursing, and health considerations within a poster, of course. This will be done through a holistic study of one selected patient, a clinical problem, or a situation. The poster should summarize requirements listed below, while your presentation should cover each area and depth. You'll record this presentation using the one-button studio that is in the nearest library, and you'll be responsible for printing your poster and presenting it to the U.S. community. The due dates of this are still pending, and we'll let you know. So, for individual preceptorships, focus on the case study on a complex patient. If you are on a travel experience, focus on a broader community or a health problem, and then address each of the standards of professional nursing practice, known as nursing practice, as it pertains to your patient or population. So, to start this off, introduce your patient or population with a summary of patient history. This is going to include biographical data. Make sure that you are protecting patient privacy, and we'll talk about that a little bit further down. But what's the history of presenting illness, what's primary and secondary diagnosis, what's pertinent family history, medical history, nutritional history, and a functional assessment of your patient. Next is a nursing assessment, so looking at the different areas here of a patient and population overall health. What were the physical assessment findings? Are they normal? Are they abnormal? How do they interact with each other? Were labs drawn? What were the results of those labs? Were they normal or were they abnormal? What were the medications that were prescribed? What were the indications for those meds? What were the diagnostics performed? What were those results? For populations, consider healthcare needs, strengths and resources, demographics, prevalence of illness, disease, and then summarize your windshield survey. Now, for the nursing diagnosis, give your top 3 priority nursing diagnoses, and one of these 3 have to be a psychosocial diagnosis. For planning an outcome, I want you to address the following. How did you plan this patient's care to address priority needs? We can talk about every patient's a fall risk and every patient's got risk for skin integrity, but that is probably not going to be your top priority thing. So make sure that when you're planning, you are prioritizing. For populations, how would you plan a public health initiative to address this problem? And then what are short-term and long-term SMART outcomes or SMART goals? So SMART stands for specific, measurable, achievable, relevant, and time. So for each of these nursing diagnoses, you should have 2 outcomes, and it's got to be something that an outsider could look at and say, oh yes, I know what you're talking about, I see how you're measuring it, this is a reasonable thing for this patient to undergo in this time frame, and it's relevant to that person's care, that population's care. For implementation, consider the following questions. What interventions, either individual or based on the population, address the nursing diagnosis and outcomes? So what did you do? What were your interventions for this? What health promotion and disease prevention considerations were implemented? What cultural considerations were implemented? What coordination of care was addressed? And you could answer these for every set of populations or individuals. And finally here, evaluation. So consider your outcomes and address the following. Were your interventions effective? Ultimately it's a meritocracy, and did what we do work? Would you change anything? What was the outcome achieved? And if it wasn't achieved, what was done about it? What happened and how did you shift? For populations, how would you evaluate a community health program in the area? So big considerations for this is to remember HIPAA. You cannot include any patient identifiers. We are in a small community, and it's relatively easy. So what you can do is say you are on a medical surgical unit in a Midwest hospital. You can say you're on a pediatric unit in an East Coast hospital. Something like that. You can't say, oh, I was at Avera Pediatrics during this time frame, or, my patient was John Smith. You have to protect their identity, and I would recommend using abbreviations, and honestly, I would change them so that they're not reflective and applicable to that real patient. So if it is John Smith, then you change it into, I don't know, Harvey Danger or whatever you want to call it. And patient HD was, in this facility in this region. And then you can kind of tell their story, leaving off modifiers that might identify them. So if you get very, very specific about your patient, you just have to be careful with that one. You want to tell the truth, but you don't want to go too far so that somebody from the community could understand who you're talking about. So with this, we do have a rubric for this. So on this rubric, we are looking at nursing assessment like we talked about. So what were the findings? What were the medications, including the indications for those meds? What were the diagnostics, including the results? And that could be labs, imaging, nuke med, etc., etc. So we are grading on this type of a scale. But you really should be able to do a nursing assessment on your patient. Your nursing diagnosis, once again, this is top 3 priorities, and at least one has to be a psychosocial diagnosis. Planning, this is the plans that we made, short-term and long-term, smart-term goals, and you should have at least 2 for each diagnosis. So 1 short-term, 1 long-term, and we'll go from there. Implementation. So looking at the interventions for nursing diagnosis and outcomes, what's the health promotion, disease prevention considerations? What are cultural considerations? Please don't say that there was none, because what was their religion? What's their background? What's any special treatment that you considered when caring for this? Dietary needs, etc., etc. So there's always cultural considerations. And then coordination of care concerns. Who all worked with this patient? Oftentimes there's providers, whether that is a surgeon or a physician or a nurse practitioner or a PA, RTs, nurses, case management, etc., etc., etc. So kind of tell the story of who all worked with this. Evaluation, were your interventions effective? What will you change giving the knowledge now? And if that outcome was achieved, or if it was not, what was done any differently? Now into the graphics and visual appeal of the poster. This does have to be 11-inch by 14-inch poster that you professionally print off. Staples or Office Depot are good areas to get this printed. If you look carefully or look online, often they will have discounted rates. But when you print this off, it does have to be clear. It has to be concise. Double check it for grammatical errors. It's got to be visually pleasing. You want to pull people in. And then make sure you include references. References could be a little ditty on the bottom corner saying, please ask for references or references available upon request. And then have a handout that you could show people. And then One Button Studio. So this is going to be how you're going to record this. So presentation will be recorded in a professional delivery. So this is going to be a professional attire. You will dress up in a business casual and use professional communication. We will talk about One Button Studio more in leadership management professional issues, in which we'll use it there. But make sure that this is a professional looking presentation. those are kind of the goals, our expectations of you. Of course, if you have any questions, please seek us out, as we're happy to help you out.